When we women, when we are born, we have a certain amount of eggs and certain quality of eggs in our ovaries. When time goes by, we still feel young and amazing, but eggs quality comes down. So between 42 years old, it's going to be very difficult to get pregnant with our own eggs. The beauty of Spain is that 30 years ago, Spanish legislation allowed for anonymous egg donation, and we can treat you in IVF Spain until 50 years old and 11 months. Egg donation is the final step in the reproductive medicine treatment of many patients. So through the young age of a donor, we bring patients to the pregnancy rate of egg donors. In Spain, donors should be young, healthy and fertile, under 35 years old. So the pregnancy rate in egg donation is age independent of every patient. Means if we have a patient at the age of 35 with premature ovarian failure, or somebody at the age of 40 with poor egg quality, or somebody at the age of 50 with her natural menopause, if a patient is ready for egg donation, she will have the same pregnancy rate as her donor, as somebody who is 30 years old. In IVF Spain, we focus a lot on the quality of the treatment through the blastocyst culture, through the embryo development till day 5. After single embryo transfer, more than 70% of our patients are pregnant. In IVF Spain, we developed programs that give a lot of security to our patient. There is one of the best programs that we have with 3 embryos, 3 blastocysts guarantee. After this program, after 3 single embryo transfers, more than 90% of all the patients have children at home. Spanish law allows for egg donation since more than 30 years. We have to be aware that egg donation in Spain is anonymous, means we can only tell age and blood group of a donor when the patient is pregnant. But according to the Spanish law, we have to generate a child that will explain the combination of a patient and her husband, and then her egg donor and her husband. I always simplify it and explain to patients that we have to find you a twin sister, somebody who looks like you, has the same color of hair, color of skin, so when the child is born, has to fit into the family. Majority of our patients are happy with our choice selection for a donor for her. We have to obey Spanish law as long as we proceed with the treatment in Spain. When the patients are coming back home and delivering children in their home countries, after the delivery and during the pregnancy, when they are taken care of through their gynecologist, of course the law of their country applies. We have to be aware that egg donation is the final step in infertility treatment of many patients. We receive patients from all around the world that are coming to IVF Spain for their treatment. The first initial step is that patient psychologically has to allow herself for egg donation treatment. The other step that is very important is how we choose donors and how we communicate to the child and how we communicate to the family that the child is from egg donation. There are beautiful books in English at the age of 3-4. We recommend you to read Fairy Tale, that the child is through egg donation. At the age of 8-9 years old, that the patients are coming here back, visit us at IVF Spain. They take pictures with us. We show children the clinic. We show children the entire team. The big part of a team is psychological psychological support. Of course, the medical team, nurses, we support your medical treatment. The psychological support, how to communicate it, where the child is from, and how to live with this. We have specially trained psychologists that will be more than happy to help you with that. Spanish legislation allowed for egg donation 30 years ago. Through this, Spanish doctors, Spanish laboratories have the longest experience in egg donation in Europe. The beauty of Spain is that a lot of research can be implemented in our daily work. In IVF Spain, we were the first clinic which performed PGS, genetical testing of embryos that were generated through egg donation, which allows us to have one of the highest success rates in Europe. So being the best in Europe allows Spain and Spanish doctors take care of patients that need egg donation from all over the world.